Hola. I'm very sorry that I don't speak very good Spanish, so you have to listen to the translation. But I did understand. Can you hear me? Is that better? I did understand Senora Loca. It's me, my glasses case. So I understand that. So I am a vet. I work for Cats Protection. So I'm going to tell you a little bit about what my charity does and give you some top tips for feline shelters. So these are some cats that we helped. They came from a house that had 60 cats in it, and they all had cat flu. And a lot of them had very damaged eyes. Out of the 60 cats, we had to remove 20 eyes because of herpes. So the picture at the top is one cat, but it's the same cat in the lower picture in a home looking much better. Cats Protection is the UK's largest feline welfare organisation, and we have three main aims. We find homes for cats in need, we support neutering, and we try to improve people's understanding of cats. And our vision is a world where every cat is treated with kindness and an understanding of its needs. So I'm sure everyone in this room would also hopefully share that vision too. To give you some statistics of Cats Protection from last year, we have 32 adoption centres. That's what we call them. They are shelters, but we call them adoption centres because the cats do not live there for life. We find them homes. We also have 250 small local branches that are groups of volunteers that work together, and many of them will foster the cats in their own homes. They don't have an actual shelter. We have over 9,000 volunteers all over the UK, so we are very lucky because they do an awful lot of the cat work. And each year we rehome about 46,000 cats. So it's a lot of cats. We also help to neuter, and that means we pay for some of the cost or all of the cost for over 150,000 cats. So it is a lot of cats, and it is about 1 in 6 of the cats that are neutered in the UK each year. Our income, the money we have, is about 60 million euros a year. So that's a lot of money. We're very lucky. We don't get any money from the UK government. It is all given to us by the British public. So it's by donations, or we have a lot of people who, when they die, they leave us their money. So we are very, very grateful to them because it enables us to do our work. So our headquarters is the National Cat Centre, and this is where I work. And it's based in Sussex, which is south of London. It's in the countryside. It's in the middle of a forest. Now, do you know Winnie the Pooh, the book, Winnie the Pooh? Yeah? The forest, in that book, there is a forest called the 100-Acre Wood. It is based on the forest where we work. And they lived in very near where we work. And we have our offices for the whole country, but also we have our biggest adoption centre there. And we also have our own veterinary clinic. All our other sites use private vets. They don't have their own clinics, but this is a very big centre. We can look after 200 to 300 cats at any one time, so we have our own clinic. So We also have 3 donkeys. They are from the Donkey Sanctuary, which is a donkey charity. But because we have quite a lot of land, we have those donkeys there, and the visitors love the donkeys. And where the donkeys come from, they now have some cats. So we've swapped. So they can publicise what we do as well as we publicise what they do, because charities working together is a good thing. So I'm going to give you a video tour of our centre. It's quite fast, so the translator might struggle a little bit to keep up, but we'll try. So I have to come out of my presentation and go into the video. They will switch the music
Welcome
off.
to the National Cat Adoption Centre in East Sussex. The centre is the UK's largest cat rehoming facility. At any one time, the centre houses up to 200 cats and
There you go.
kittens.
This is the
More than
reception
1,000
area
cats and kittens successfully find
where
new
we
homes
greet
by
the
adoption
members of the
centre
public, but we're going to take
Cat
you
Protection's
on the
aims are to provide
journey
information
that the
on
cat
feline
would go
welfare,
through
as well
going
as to
in
neuter
the
any
adoption
home.
centre. So we start off
Cats
at
that
the
are not
very
yet ready
back
for
of the
rehoming are
centre,
housed in the units
and
at
this
the
is
back of
where the
centre.
new cats
These
arrive.
areas are only
We have
accessible
to
by
be very
staff.
careful
Strict
about
biosecurity
disease
measures
because
are
we
in
have a
place
lot
to
of
help
cats
minimise
coming
the
from
risk of the
different
spread of
areas,
infectious
so
disease.
we use foot baths.
When a new
And
cat is admitted
these
to the
new
centre,
cats may have
full personal
infections,
protective
so
equipment
the
must be
staff
worn.
have to put on lots of protective clothing. And we
Newly
have a
admitted cats
room
must
where the
firstly checked
staff
over
will
by the
do
centre staff in the cat care room.
an initial check of the cats when they
Cat is
first
weighed
arrive.
and a health check examination
They'll
is
weigh
carried
them
out.
and they will check them over. They also get checked by a vet within the first couple of days,
The
but
health
the
check
staff
includes a
look to
routine
see whether
stamp
the
examination,
cats might be
which
at
will help
risk of
screen the cats for
infectious
ringworm before
disease.
they enter the shelter.
They shine a woods lamp and ultraviolet light over the cats to see if they
After the
perhaps
health
have
check, the cat will then
ringworm.
be housed in the
No,
admissions
ringworm
room or
a
moved into
fungal
the isolation
infection.
unit.
And any cats that we think have
there
an
is any
infectious
concern that a cat may
disease
be
go
showing
into
signs
our
of infectious
isolation
disease,
unit.
the cat is
And this is
transferred to the
completely
isolation unit to
separate
await
from
a
the
medical
rest
examination.
of the centre. It is very self-contained,
litter trays and food
and
bowls are
here
used in
we
the
use
isolation ring.
disposable
These are
litter
disposed of
trays
daily
and
to help reduce
bowls
the level of
so that they
environmental
can just be
contamination
thrown
within the
away
unit.
after they're used, so we don't risk
The isolation
carrying any
unit is a
infectious
completely
disease.
separate,
It
self-contained
has its
area.
own separate
It has its
area
own
to
separate
wash
tray wash,
everything,
laundry,
to
and
clean
food
the
preparation
trays,
areas.
to prepare the food, so that there's no chance that any of the
Entry into the isolation
infection
unit is strictly
can go
controlled.
to any of the other parts
Cleaning
of the
utensils and
cattery.
equipment are colour-coded
You
red
have all
to
its
ensure
own
they are not used
equipment,
elsewhere
and it's
within the
always
centre.
red, so it can't get mixed up with the
Cats not
equipment
showing
from the
signs
other
of infectious
parts.
disease are
The
housed
cats
in the
that
admissions area.
we think are not infectious but have just come in and we have to see how healthy they are go in the
Two
admissions
pieces of bedding are
wing.
used in the sleep
And we
area for
have
scent
a sort of
continuity.
sleeping area, what
Only
we
one
call a
blanket is
pod,
removed
but
to
it's a
be cleaned
sleeping
at
area
any
that
one
we
time.
put bedding
All cats are
in
provided
and
with a
somewhere for
place
the
to
cats
hide.
to hide,
A hiding place reduces stress
and
helps the cat to feel
toys and
secure.
things like that. They also
admissions
have an
wing is a
outside
quarantine
run,
area
which you'll
and a
see in a
place of
minute,
high disease
but we
risk.
have different coloured equipment
Cats are
in this
housed here for at
part,
least
so
the
it's
first 7
separate
days of
from
their
the other
stay with
areas.
cat
This is the
protection.
outside run,
Cats
so
remain
the
in the
cats
admissions
have
wing while they
perches
undergo any
and
necessary
we can
veterinary
hide
treatment.
the litter tray, and also they get some fresh air in that outside bit.
All cats are vaccinated.
In the inside
mutated,
sleeping area,
microchipped,
they have
and receive
underfloor
flea and worm
heating,
treatment.
so they have better
A cat is moved to
conditions than the
homing wing
staff.
A minimum of 48 hours after the first vaccination. And when the
We
adopted
don't have
centre vet
aircon,
has
but the
deemed them
cats
fit
do.
to home.
So the cats get very well looked after.
All pens
This
are
is
thoroughly cleaned and
demonstrating
disinfected on a
our
daily
staff
basis.
cleaning the pen. The pens are cleaned every day. We put the
Cats are removed
cat
from
in
the
the other
area
part
when
of the pen
disinfecting.
while it's cleaned.
Gloves and protective clothing must
And
be
then
worn.
we put in 2
All
bits of
cleaning in one
bedding,
area
and we
should be
only
completed
wash
before moving
one
on to the
each
next
day,
area
so we
for the
change them, so there's always something with the same smell on for the
The
cats.
maternity wing houses pregnant
We have a
and nursing
separate
queens, as
area
well as
where we
kittens
keep
that may not be
pregnant
fully vaccinated.
mums and kittens,
These cats are the most
and
susceptible
we are
to
very
disease.
careful that lots of
The
people
maternity
don't come
ward
and
is built to
go
the same
through
specification
maternity.
as
Again,
the
we have a
isolation
separate
unit.
area where the
The
litter
food prep
trays and the
tray
bowls are
wash areas
washed,
have their own sinks to
and a
avoid
separate
cross-contamination
area
of
where
litter
we
trays
do
and
the food,
bowls.
and this is separate
to
for
encourage
the
frequent
mums and
hand washing.
kittens. Again, the
Their
kittens are
siblings
very
and their
vulnerable
kittens
to
are
infection,
generally
so
more
we're very
vulnerable to
careful, and
infection,
we have
and therefore
yellow
items
equipment
particularly
here.
important.
So, and
Kittens
obviously
need to be
lots
cleaned
of
out 2
lovely,
to 3
cute
times
kittens.
daily.
We have to clean their pens more frequently because they make a
Being
mess,
born and
as I'm
raised
sure
in a
you
resting
know.
setting can present a challenge,
And
as
here's
kittens
some
later
lovely
adapt to a
kittens.
domestic home
But
environment.
being born into a centre like
structured
this,
kitten
it means the
socialisation
kittens are
programme
not necessarily
help
going
prepare
to
the
be
kittens
well
for a
prepared for
variety of
going into a
experiences they
home,
may encounter in
because
later
they
life.
are during their, this is
programme,
during their
covering the first 2 to
socialisation
8 weeks
period.
of
So
life,
we do a
introduces and repeats
socialisation
various
period,
positive experiences
a
throughout the
training
socialisation
scheme,
period of the kitten.
so that they get used to lots of different things. So we handle them by different people,
moved to the
and
home
we
unit
play them
once the cat has
noises
been deemed
of
fit to home
washing
by the adoption
machines
centre's
and
vet.
hoovers, so they get used to a home.
this area,
This is the
members of the
homing
public
area.
can
This
view
is where the
cats when ready
public
for
can
rehoming
come in to
and
meet
find out
our
more
cats.
information
This
about
is
them
when
from
the
the
cats
census
are
town.
ready, they've been vaccinated and neutered, etc.
Medical and behavioural
We put
assessments
little
are used to gather
stories up
information
to
about
make the
cat,
cats
so
appealing.
this can then be passed on
So
to a
hopefully
prospective
people will
new
want
owner.
to take them home. Here's one called Maggie. This is like me.
The average length of stay for a cat in a
If a
captive
cat
adoption
has taken a
centre
long time to
is
find a
around
home, we
44 days.
highlight them, we make them the cat of the week. I'm not sure that one likes children. We also have a small room that we call our meet and greet room, and this is where
Prospective new owners can
potential
spend time with their
adopters
chosen
can
cat
meet
in
the
meet
cat
and
they're
greet room.
interested in outside of the pen, because the cat will probably behave a little bit
Adopters
more
are able
normally
to
there,
interact with the cat
and they
away
can
from the cat
decide
environment.
whether they want to take the cat home, which of course they will. And we have an enrichment room. This is a room where we can spend more time
room
with
is
cats
available
that
for
are
staff to work
perhaps
with adult cats that
bored
may be
or
bored or
frustrated.
frustrated.
They've perhaps been in with us for longer. Or
The room can
perhaps
also be
the
used
fat
to conduct
cats,
a
like this one, where we
desensitisation
can do
programme
more
for physical
exercise with them, and the staff can just
Overweight
spend
cats can also
more
use the
time
room
with
to
them.
encourage exercise and play.
We have our vet clinic, but because the
adoption
centre
centre
is
vet
very
will perform
big,
twice weekly
we
vet
don't
rounds
take the cats to
examine
the
and treat
clinic
the
every
cats at the
time
centre.
they need a checkup. We have a big trolley, and it's like
full
a
clinical
consulting
examination
table in
is
the vets, but you
undertaken
can
as soon
wheel
as
it.
possible after
And
cat's
so
entry into Cats
the
Protection's
vet
care.
goes up and down the corridors to do the basic examinations and vaccinations.
Cats may be
But
rehomed
obviously
at
we
least
do
48
have
hours
surgery
after
facilities,
vaccination or castration,
and the most
7
common
days after spaying.
operation is neutering. So this
The
obviously is a
adoption
cat
centre
being
vet must assess whether a
spayed.
cat is fit
This
to
is the
rehome
cage
from a
room in the
veterinary
clinic.
perspective.
So they will
must be able to
do
cope with
10 to
transition to
14
an appropriate
operations a
rehome
day,
and be expected to
usually
enjoy a good
neutering, but
quality
also
life.
a lot of work, a lot of dentistry work on the teeth. So that is just a very, very quick view of our centre. So if ever you are in the area, if ever you go to Gatwick Airport, we are near there, you can all come and visit. So now I'm going to give you, go back to the talk. And I'm going to give you some top tips if you want to have your own shelter, what I think are the most important things to think about. So I'll go through. And so my first top tip is a question. Is a shelter right for you? Because shelters are very, very expensive to build. So you have to have enough money to actually build a reasonable shelter. But also, even once it's built, they do cost a lot of money to run. So you have to know that you will have enough money and enough people to run the shelter once you've built it. The other thing is really, because we don't want to keep the cats in the shelter forever, we want them to be adopted. So are you in an area where there are enough people who will actually want to adopt the cats? And there might be other ways of achieving your goals. Today, obviously, we have heard a lot about cats in colonies and street cats. And for many cats, actually performing TNR, trap, neuter and return, is actually better than spending lots of money on a shelter. Also, as we do, we have a lot of fosterers, and they are people who have 1 or 2 cats temporarily in their home, and they might have 1 pen in their garden or use a spare room to look after the cat, and that is much, much cheaper than building big shelters. It might also be possible to adapt an existing building, something like a building that was a commercial cattery. And that is obviously much, much cheaper than having to save up the money to buy a big shelter. And a problem we have in the UK, I don't know if it's a problem here, but we find it hard to find sites where we can build. That often the local government doesn't like the idea of a cat centre. They think it's going to be noisy, they think it's going to be smelly, which obviously it's not, but they're thinking about dogs, really. So my second tip is remember where cats came from. Remember how cats have evolved. They've evolved from the African wild cat, and these were originally solitary hunters. And although cats have evolved and they are a bit more social now, and obviously in feral colonies we have a lot of related cats together, but most cats don't like other cats that they are unfamiliar with. So the idea of putting lots of cats that don't know each other together in a small space can mean that it causes a lot of stress for the cats. And also, cats are very good at carrying disease without showing symptoms. And you heard about feline leukemia and FIV today. And they've sort of evolved like this because in the wild, with the African wild cat, they wouldn't meet other cats very often. So if the virus was going to be transmitted, it had to be able to survive for a long time in the cat. But it does mean that a lot of the cats that come into our care are already carrying infectious disease. And when we cause them stress by putting them in our shelter, it means they start to shed those organisms. Top tip number 3. Sanctuaries don't help many cats. Now, when I say a sanctuary, I mean a place where cats are taken in, but they stay there for their whole lives, and they are not rehomed. And often people say to me, but, you know, there's nowhere for the cats to go. But if we keep cats like this, like in the picture, it takes a lot of resource, but you can only help a certain number of cats, because either you have to wait until one has died before you take another one in, or you take in more and more, and then it becomes very, very overcrowded, and then there's a lot of problems with disease and stress, and the cats don't have very good quality of life. It's very hard to maintain a good life for cats if they are in a sanctuary situation. So we don't do that. We only take in cats that we're going to find homes for. So top tip number 4 is don't build big, build smart. The centre that I showed you in the video is the biggest cattery in Europe. There are 200 pens, but we would never ever build one quite so big. It is actually quite hard to manage. And actually, you might think there are lots and lots of cats that need help, so we need lots of pens. But the number of pens you really need are related to how many people are willing to take your cats. You can have a small number of pens, but if you have lots of people coming in wanting to take your cats, hopefully each cat will only be in the care for a very short time, perhaps 2 or 3 weeks. So if we get a very short time they're in with us, we can speed up how quickly cats pass through our facilities. So even with 10 or 20 pens, you can home a lot of cats. In this picture, this is one of our new centres in London. It is very small. We only have about 20 pens, but they are homing about 700 cats in a year through 20 pens. So you don't need to build lots and lots of pens to be able to help a lot of cats. And being in a facility, even a good one, is not nice for the cats. So the quicker we can get them out, the better. So it's better to have them in a short time and then help more cats by being able to take more in than having them all living in pens for a very long time. Top tip number 5, don't keep feral cats in shelters. And obviously the cat in the picture is a very happy, healthy feral cat. It's been neutered and ear-tipped. But if cats have not been socialised, taking them into shelters causes them a lot of stress. So we do not take feral cats into our shelters. Occasionally they come in by accident because people don't always tell you the truth about cats. I'm sure you know that. So we would definitely say that trap, neuter and return is best for non-socialised cats. So we only take in socialised cats that can live in a home. Now, sometimes people will bring in feral kittens. These are ones that are very frightened and they hiss and they spit. Unless you get kittens very, very young, during the very early stage of their socialisation period, which is 2 to 7 weeks, then it is difficult to make them into tame, good pets. And often people take them in too late, and then the cats end up being in an in-between state. They're not proper ferals that can live on the street, but they're not tame enough to be good pets. So if you can, what I think with feral kittens is that you should neuter them. You can neuter them very early and put them back where they came from. I have neutered kittens that were about 6 weeks of age, feral kittens. So for most feral kittens, unless you get them very early and have people who are very good at socialising them, it is much better that we neuter them and we put them back. Keep cats singly or in small groups. Now we have the luxury that our cats, when they come into our care, they each have their own pen, or we might have 2 cats in if they've come from the same home. But cats don't really like being in the presence of cats they don't know, so keeping them in communal pens where you are adding more in all the time, and some are being homed, so there's a big turnover all the time, is very, very stressful for cats. So we do everything we can to help them avoid the sight, the smell, and the sound of other cats. So we have solid walls between cats. We try to not have them staring at each other. We try to keep some of their own smell in the pen, so that they will feel more relaxed. And sometimes, even when cats are brought in, 2 cats from the same household that the owner says they get on very well together, sometimes when we put them in a pen where the space is restricted, they don't actually get on. Because in the house, one lived upstairs, one lived downstairs, and they actually avoided each other, but the owner didn't recognise that. So sometimes we even separate them if they are not happy. But ideally, each cat should have its own space. And top tip number 7, however good a pen is, and we're lucky we have very good pens, but that's not how the cat sees it. The cat sees it as a prison. Cats are control freaks. They are the ultimate control freak. Do you understand what I mean by that? They like to have control over their own environment. They like to have choice. And when we put them in a pen, even a good pen, we take their choice away. We try to give them some choice by having a sleep area that's a bit warmer and having an outside run that's a bit cooler, and they can have a little bit of choice. But it is like saying for us that we would live in our bathroom for 5 years. And it might be a very nice bathroom, but we would quite like to do other things and go to other places. So we have to remember that when we take the cats in, from their point of view, we've not done a good thing. So we need to keep them in that pen for as short a time as possible. If you're thinking of having a shelter or fosterers, try to get the best pens that you can afford. We have all sorts of different pens across the UK, and the one in the middle in the garden, that is one that one of our fosterers might have. So they can only keep 1 or 2 cats at a time, but that's in their garden. And some of our pens are wooden. It's not ideal because of infectious disease, but it is much cheaper than paying for very expensive pens. And if you look after them well and put preservative on them, they can work very well. We also have some metal and glass pens, but you don't necessarily need to have a very big, very flash adoption centre. You can have a small number of pens, but you want to try and get them to be as good as you can afford. So I'm going to say a little bit more about pen design. These are some of our latest indoor designs. The picture on the left is a cat's protection pen, and this is in a big pet superstore. So it's a big pet shop that has lots and lots of other animals, and it sells cat food and dog food and rabbit food. And we have 3 pens in this store. We only put cats in here after we have already prepared them. They've already been neutered and vaccinated. But because lots and lots of people visit the shop, we find homes for these cats very quickly. And some of the cats had been in one of our other adoption centres for 6 months, and within a week of being here, they were found a home. It's quite controversial because a lot of people don't like pet shops, and certainly we don't like kittens being sold from pet shops, but these are adult cats that need a home, and we actually get lots of homes this way. But the pen is very carefully designed with very good soundproofing, because we were worried with all the people coming into the shop and looking at them that they might get upset by that. And actually, because they have a lot of space and they have somewhere to hide, they actually are very happy in these pens. The picture on the right is from Battersea Dogs and Cats Home, which is a very famous shelter in London. Because it's in the middle of London, they don't have much space, so they all just have a single compartment, but they give them choices through having places they can hide and little steps they can climb up. When you're thinking about designing pens, there are several things we have to consider. And number 1 is about the cats. We have to be able to provide for all their physical needs, but also for their behavioural needs too. It's important we think about their minds as well as their bodies. But also we have to think about humans. We have to think about health and safety. So the pens have to be designed so they are quite easy to clean, because with some of our pens we found after a while the people who were cleaning them were getting sore backs and painful backs because they were leaning in all the time. So you have to design them so they're okay for the people, but also so the access to the cats is quite good, because we don't want people to get bitten and scratched. And we also need to be able to observe the cats. And if it's in an area where the public is going to come in to choose a cat, they have to be able to see them. So it has to be such that, yes, we give the cats somewhere to hide, but also that the public can see the cats, or else they're not going to want to take them home. So in terms of disease prevention, the sort of things that we're thinking about, we don't actually have beds like the one in the picture. That's from the internet, obviously. But we like them to be safe and secure. We have what we call a safety corridor behind a row of pens, so that the cats can't escape and they can't get contact with each other. It's very important to have very good ventilation. Cat flu is a massive problem in cat shelters, and if they don't have lots of fresh air, then you will get problems with cat flu, and it is better to have outside natural air coming in than artificial ventilation, if you possibly can. We want an ideal temperature between 15 and 24 degrees. In Barcelona, that is probably quite easy to achieve. In the UK, in winter, it is hard if you have an outside run, but we have heating in the sleeping areas. And we want the surfaces to be very smooth and non-porous so that we can clean them and we can use disinfection repeatedly on them. And as I said before, we have solid barriers between the pens. So if cats sneeze, the bugs don't go from pen to pen. And also the cats can't touch noses either. When it comes to the behavioural side, ideally we want enough space that the cats can exercise, that we can separate out their resources. And by that I mean that we can have space between the litter tray and the water bowl and the food bowl, so that not everything is all so close together that they don't want to use them. It's very important you give them somewhere to hide. In the picture, this is what we call the feline fort. It's a cat hide, and it's made of a material that can be disinfected between cats, but it means they've got somewhere to hide underneath, but because of the cut-out areas, we can still see them, and the public can see them, and when they're feeling a bit more brave, they can sit on the top, and the cats really love these. We ideally have a private area hidden away for the litter tray, so the cats will use the litter tray, and we have things like perches and different heights, because cats live in a three-dimensional world. They want to be able to go up, and they feel safe often when they're high up and they can observe things. And we do everything we can to avoid them having contact or sight or sound or smell of other cats. These are some examples that are not particularly good. The communal pens, the public often think these are good because they think the cats can move around more. But if you look at the picture on the top left, all the cats are trying to get as far away from the others as they can. They can't get very far, but they're all sitting there by themselves. They don't want to all cuddle up. And even where people have pens, if they have pens that are very close together and there aren't barriers between them, then all the viruses, particularly the respiratory viruses, cat flu, etc., can just go through all those pens. And the cats can smell all the other cats and often will be very stressed. So these are not ideal. Top tip number 9, if you have dogs on the same site, and there are many charities where they rehome dogs and also cats, you want to keep the cats as far away from the dogs as possible, because barking is very stressful for cats. I myself, because I work with cats, if I visit a dog shelter, I think how noisy it is. You walk in, the dogs are barking. It would drive me mad. But for cats, it's very stressful. So it's ideal that we put the dog area and the cat area as far away as possible. And in some places, I've seen them where dogs are on the ground floor and the cats are upstairs. So they're right over the dogs, and that is not ideal. They'll hear all the barking through the floor. And soundproofing, if you can't move them too far away from each other, soundproofing is very important. Top tip number 10, prevent stress. That's the same for all of us, I think. Even people giving talks, we want to prevent stress. But for the cats, it's very important. Stress is a natural thing, and we all need stress to help us cope. For example, if there is something threatening, we need that bit of stress to make us either run away or fight, flight or fight. But if we have stress over a long period of time, then that has a physical effect on the body and on the mind. And it will suppress the immune system. So this means that the cats are more susceptible and more likely to pick up infectious disease. They also might get non-infectious problems like over-grooming because they feel stressed, or they might get diarrhea because they're stressed as well. So if we have good pen design and we give them environmental enrichment, that can help. So I'm going to talk a little bit about enrichment. As I've said several times, giving them a place to hide is really important. And you don't have to have the sort of hides we have. You can just use a cardboard box and cut holes in it. But giving the cat somewhere to hide has been proven to decrease their stress. Once the cats have been with us for a while, they get bored. So it's really important we do things to try and take boredom away. So we use feeding enrichment. And the picture on the bottom left is something you can buy where the cats have to fish the food out. But you can make your own versions, like in the upper picture, with an old egg box and then screwed up newspaper and put bits of dry food in. So the cats have to take more time and make more effort to find their food, because in the wild they would be spending lots of their time hunting. So rather than just giving them a bowl of food, we make them work for their food, and that's very good for their mental health. We can also make similar toys with toilet rolls, like in the picture in the top right, where we make a pyramid of toilet rolls and put dry food in, and the cats have to use their paw to fish those out. Active play is very important, and things like the fishing rod toys are good, so we're not using our hands and our feet, but all these things help. We use what we call the double bedding system that I mentioned at the beginning, where we put 2 bits of bedding in and only take 1 away at a time for cleaning. Because as we clean the pens every day, we are removing the cat's smells. And for the cat, that's quite disorientating. So we leave something in the pen that has their familiar smell on and just alternate when we wash them. Obviously, cats need somewhere to scratch, and it's quite hard using scratching posts because you can't disinfect them, so you would need to get a new one for every cat. So what we do is we get squares of carpet. You can get them from carpet shops. You know, we have the books where you look to see what colour carpet you want. And they will give them to us for free, and we tie them to the door, and then the cats can use those. Or rolling up a bit of corrugated cardboard and again fixing it onto the mesh so the cats can scratch. And very soon it ends up like that. But there are ways which we can use cheap things that we can dispose of afterwards, but we can still provide enrichment for the cats. And we use Feel Away. Feel Away was mentioned earlier on. It's expensive to have one of their diffusers in every pen, but you can, when a cat is first brought in, you can spray the spray in the pen, or have a plug-in Feel Away in a corridor or in the clinic. But that helps to also make them feel less stressed. Top tip number 11, find a shelter-friendly vet. In the picture, this is Natalie. She is one of the vets who works with us. But you want to find a vet who has empathy for your cause, somebody who really, wants to help in the way that you want to help, and someone who will put animal welfare first. Sometimes, I'm sad to say, as I am a vet, some vets are more interested in the money. Most are interested in animal welfare, but you want to find a vet who is sympathetic to your cause. You also want somebody who will make pragmatic decisions. Veterinary medicine is advancing all the time, and yes, that is a good thing, but it means that sometimes we find some particularly young vets want to do very complicated, very expensive methods of treatment or surgery, which we can't afford. When we have about 6,000 cats in our care at any one time. So we want somebody who will not feel you must do every test on every cat, that we just do what is really necessary for the health of the cat. And we also want vets who will work in partnership with our staff and our volunteers so that we can discuss the cats and the cases, and perhaps if a cat needs to be put to sleep, euthanized, we can have a discussion, and we're working as a team, and we want the vet to be part of our team. And they should be part of the everyday management of the shelter. So they not only just come in to treat the ill cats, but they perhaps help with things like what is the best protocol for certain diseases, or how do we do cleaning in the best way or disinfection in the best way. Top tip number 12. Prevention is better than cure. So if you are taking cats into a shelter which increases their risk of getting disease, we really need to be able to look after them. And I would say with the top 4 things on the list, if you can't afford to do these things, then you cannot afford to have a shelter. Every cat needs to be health checked. Every cat needs to be vaccinated. They all need parasite control, and they all need to be neutered. Now, if an organisation does have enough money, it is very good to microchip all the cats. And we microchip all the cats that come into our shelters. But it's not as important as vaccination. Also, screening for disease. As I showed you in the video, we use the woods lamp to shine UV light on the cats, and that's a screen for ringworm. It's not absolute, but it helps us to remove or pick out for treatment cats that may be infected. But that's quite a cheap test. Once you've bought your lamp, it's very cheap. We do test our high-risk cats for feline leukemia and FIV, but if you're running a shelter and you're very short of money, it is probably not the most important thing to do, because if you're keeping your cats separately, you can't spread FELV and FIV in the shelter. But obviously, if we can afford to do some testing, that is good. But the most important thing is the health check, vaccination, parasite control, and neutering. Top tip 13. You can't afford not to vaccinate. Lots of people say to me, but we can't, I talk to people with shelters all over Europe, and they say we can't afford to vaccinate. And I always say, but you can't afford not to vaccinate. Because if you have a shelter and you don't vaccinate, you will get cat flu, and you will get parvovirus, and all sorts of other problems. And it will cost you a lot of money, or you will have to destroy all the cats. So it is actually much better and actually cheaper in the long run to vaccinate your cats. And it is worthwhile talking to your vet, or what we do is, because we're a very big organisation, we talk directly to the pharmaceutical companies, and we get our vaccines at a very, very cheap price. They make no money from us, but it is good publicity for them. So we vaccinate all our cats. We don't vaccinate for rabies. If you're in an area where there is rabies, then it's very important they're vaccinated against that. But in terms of the things we consider to be essential, it's to vaccinate against feline parvovirus. That's the same as panleukopenia or feline enteritis. That's all the same virus. And also cat flu, the herpes virus and Kalichi virus. And those are the really essential ones that in every shelter the cats should be vaccinated against. Again, if you have more money, then it is good to vaccinate against other things, but it is not so essential. We vaccinate our cats for feline leukemia, not really to protect them while they're in with us, but because when they go out into their new homes, that helps the overall amount of feline leukemia in the UK to be very low. If we have problems with other diseases in certain centres, like chlamydia or bordetella, which is kennel cough, the kennel cough bug, we will sometimes use those vaccines, but not all the time. Most of the time, we don't need to use those vaccines. But the very important ones are parvovirus and cat flu. Top tip 14, this is echoing what Valentina said. We want to neuter as many of our cats, hopefully all our cats, before we send them to a new home. So what we do in most areas where we can find vets to do it is we vaccinate our kittens at 8 weeks of age, and then 2 days later we neuter them. So they're neutered when they're very, very young, so that most of the cats we home are already neutered, so we don't have to chase up the owner to see if the cat is vaccinated. We recommend generally that owners, just with ordinary owned cats, neuter before 4 months, but for ferals or shelter scenarios, it is very safe to neuter them earlier, as we heard today already. We have a special area of our website that is for vets to give them information to encourage them to neuter earlier and neuter kittens. And it is called KIND, the Kitten Neutering Database. So you can look that up. We have videos of the procedures. We have lots of information about anaesthetic protocols. We have lots of scientific papers. And we have a register of all the vets in the UK that will perform early neutering to help our volunteers and also the public to find vets. But there's lots of useful information, so do look at that if you want to. And we're always happy for any of our materials to be translated into other languages. So if anyone wants to translate anything, they're very welcome to do that. Top tip 15. There are 21 tips, so we're on 15 now. Choose the cheapest but appropriate course of treatment. As I said earlier, veterinary medicine is getting more and more advanced, and more sophisticated, expensive things can be used. Sometimes I would question whether sometimes expensive, very in-depth treatments are being done for the cats or whether they are being done for the owners. But in a shelter, if we spend a lot of money on one cat, that means there are other cats we can't help. So, for example, in the pictures, if we have a cat that has a badly fractured leg, it might be possible to use pins and wires to mend it, but it will need to be in our care for a long time, and it will cost us lots of money. So we would amputate the leg, because the cat will be ready to go into a new home in 10 days, whereas with all the orthopedic surgery, it may be 2 months before it can go. And being in a pen with they're what we call external fixators, there are pins on the outside, it's quite hard for them to go through the cat flap and things like that. So we always opt for what are the cheapest methods that will speed up our ability to get the cat into a home. And we don't do any treatments like chemotherapy or using interferon or we don't use expensive drugs at all. And anything where actually the outlook is poor, again, we're not going to spend lots of money if actually the cat's not going to do very well anyway. Top tip 16. This might be controversial, but remember that the word euthanasia literally means a good death. Now, no one in this room wants to perform euthanasia on healthy cats, but sometimes people get so obsessed with never performing euthanasia that they allow cats that are very ill or suffering to continue to suffer. And we should all remember that euthanasia should be seen as a good welfare tool. And if an animal is suffering, or an animal, we can't make it better, we can't get it into a home, it is better to perform euthanasia. And as a vet, I feel it is a privilege that we can do this, that we can stop suffering. So remember, if we have animals that are in a very bad way, euthanasia is very important. Top tip 17, good hygiene is vital. You saw in the video that we have very strict systems in our shelters to keep disease under control. So you want to use a disinfectant that is effective against the infections you are likely to see. Not all disinfectants kill all the different viruses and bacteria. We also have to choose one that is safe for cats, because some disinfectants that contain phenol are toxic to cats. So things like Dettol. Do you have Dettol? Yeah. Anyway, trade name. But some types of disinfectants are poisonous to cats, so you must be careful to choose one that is safe. It's very important, if you have a pen that is very dirty, perhaps there's food, perhaps there's feces around, you must clean it, physically clean, and remove that before you put the disinfectant down. You can't just throw disinfectant in and think that that will work if there is a lot of dirt or feces in the pen. It's very important that we wash our hands very frequently, and going from pen to pen to pen. People are the most likely thing in a shelter to pass infection between cats. So we must be very careful that we are washing our hands, and if we can afford it, that we're using disposable aprons and gloves. And in an ideal world, it's best to have separate areas for cats with different risks of disease. So that the new arrivals will be in one area, the kittens and the mums will be in another area. We'll have another area that the public can come into to look at the cats that are ready to be found homes, and that we have an isolation area for ill cats. Obviously, not everyone can afford that, but it is ideal, and to have separate equipment. The colour coding is an easy way to keep the equipment separated. And in some of our centres, we actually have a mop and bucket for each pen. And people think, oh, that's very expensive, but actually it is cheaper to buy lots of different buckets than to treat a lot of very sick cats. So sometimes the things that people think, oh, that's expensive, actually in the long run, it's not. This is how we demonstrate to people, if we're going to our isolation unit, they must wear the full body suit, have an apron, have gloves, arm protectors, shoe covers. That's only in our isolation area where we have infectious cases, but it is important, if we're going to avoid getting outbreaks and epidemics, that we're very, very careful if we have a lot of cats together. So using that protective clothing is important, and if you can't afford clothing that's disposable, then at least, using perhaps a shirt that you take off and you change into different clothes when you go home, that helps, so you're not taking any infections to your own animals at home. And between when we move cats out and they've gone to a new home, we do a very thorough, very deep clean on that pen before another cat goes in. Ideally, if you have a big centre, you have different people cleaning the different areas, but often we don't have enough people to do that. So we would normally clean our kittens first, then our healthy cats, and then the ones with infectious disease, so we're less likely to infect the healthy animals. Top tip 18, give information to the adopter. It's very important that we educate the people who are taking our cats, because what we don't want is we don't want the cats to come back to us. So we give them information about the cat. Some of the cats we don't know very much about because they've been strays or someone has dumped them on us. But we might have gained some insight while they were with us. So we give them details of their medical history, the vaccines, the parasite control. We also give them information on how to introduce the cat to their household, particularly if they have other cats, because the most common reason why cats are returned to us is because they don't get on with an existing cat in the house. And so we talk to people about a very slow introduction, where we put the new cat in a spare room, we swap smells before we introduce the cats, and do a very, very gradual introduction. So if there are other animals in the house, they're accepted. And if the cat has a health problem, then we give the person information about this. In the picture, these are a range of leaflets that we have written for owners on all sorts of different aspects of cat care and cat disease. They're all available on our website. So again, you're very welcome to use those or translate them if you want. But we have a whole range on all sorts of things. And also you need to tell the adopter what help you can offer once the cat has been homed, so that they know that perhaps they can call you up if they have any worries. Because the more support you give to people, the more likely it is that the homing will be successful, because we don't want the cats to go to a home and then the people think there's a problem, they bring them back and the cat goes back and forward. That's not very good for the cat or for us. Oops. 19. No one knows everything about cats. I don't know everything about cats, definitely. We can all learn more, and I think it's very important with shelters that people are trained, because quite often, if you've had cats yourself, or someone's had many cats as pets over the years, they think they know everything about cats. But actually, how we look after cats in a shelter is different to how we might look after cats in a home. And it is more like a farm vet having to treat a herd of cattle or a herd of sheep. We have to look at the whole herd of cats. So it's important that people are trained so that they understand about things like hygiene and disease transmission, and also that they understand something about cat behaviour, because cats are not always easy to read, they're not always very easy to understand. And it's important that even if people know a lot, that they are constantly going on refresher courses. And it's really useful to visit other shelters, just so that you perhaps learn from there the good things about the shelter. But even visiting a bad shelter, that can teach you a lot. It can teach you what not to have in your shelter. And we are always very, very happy, as I said, for people to come and visit our facilities. They're not perfect. They may look good, but we've learnt and we're constantly improving them. But if anyone ever is in the UK and wants to visit our centres, you're very, very welcome. Top tip 20, learn to say no. It is a common problem with all of us who really love cats and we really want to help them, that we find it difficult to say no. But if we can't say no and we just keep taking more and more cats into our shelters, what will happen is we will get infectious disease outbreaks. And certainly in some shelters where people have open intake, i.e. they say they will always take an animal in, they will never say no, what happens is that lots and lots of cats die because they are overcrowded and they get lots of disease. So it's important to remember that you should only take in the number of cats that you can actually look after properly, and only take in as many cats as you think you are going to be able to find homes for, because just keeping cats in pens for a very long time is not helping them. They are better off neutered and being on the street than living in a pen for years. So, I'm coming to my final tip. To celebrate your successes. Working with animals, there's a lot of rewards, but also a lot of frustrations, and sometimes it can be upsetting. But sometimes you just think about the bad things, so you should celebrate your successes. We all have failures or things that don't work as well as we would like, and we have to learn from them, but we have to remember that we're all doing lots of really good things for cats. And this year is Cats Protection's 90th birthday. So this cake was made by one of the vets who works with me. She's a very talented lady, but she makes very good cakes, so it's a great cake. So thank you very much for listening. I hope it was not too difficult with the translator.